Welcome to the Belly Brain Connection. I'm Hannah Winans. I'm on a mission to help educate people about the connection between our gut health and mental well-being. At least 95% of our serotonin and 70% of our immune system resides in our guts. I believe that our gut health is the cornerstone to our overall health. And when we nourish our bodies, we nourish our minds. Belly Brain is for informational purposes only. I'm not offering medical advice here. If you need medical advice, please consult your physician. Welcome back. Today is episode 28. Last episode, we talked a little bit about what we're putting on our skin, what we have around us in our environment, such as detergents, plastics, parabens, things that are in our cosmetics and our lotions, and how those can affect our gut health. So hopefully you learned a little bit last week, but this week we're going to do something really different. I want to tackle the metabolic theory for mental health. So we're going to do a two-part series, and I'm hoping that I can bring this information to you clearly and concisely. I've been intimidated. I've been actually wanting to do this for a while. I've touched on this in previous episodes, but this is the metabolic theory for mental health is really what got me going with Belly Brain, and it's a heavy topic. It's deeply personal. And so I've been kind of avoiding taking it to a deeper level. I've kind of just touched on it, and I've been enjoying kind of bringing to you lightweight belly brain stuff and, really kind of helping to educate people about the connection between their gut health and mental health and, the food that you eat and how that affects your mood. But today I need to go a little bit deeper because this is just something that I'm really passionate about. And I know there's some new subscribers out there who maybe haven't gone back to listen to the previous episodes who are wondering, what is this all about? So this is kind of really the root of why I started Belly Brain. So today we're going to talk a little bit more about the book Brain Energy. And so I'm going to be doing a lot of reading of different things. I usually try not to read too much and try and just kind of freestyle. But because this is such an important topic, I want to make sure I get this information to you correctly. And I am in no way a mental health professional or a therapist or any of that. So the better thing for me to do in this situation, I think, is just to read directly from the professionals. I also have struggled bringing this to you because I'm I'm really looking at nutritional support for mental health issues. And in that, I don't want to diminish or do anything to hurt anybody's feelings or diminish the work that people are doing with their loved ones and their clients in the realm of mental health. And it's a fine line, and I'm going to try really, really hard to just share with you kind of what I believe, what's on my heart, um, without, I don't want it to come across like I'm passing any kind of judgment. It's making me emotional on anybody who's really going through this. It's just maybe another way of looking at the issue. And again, Dr. Palmer, his book and his teachings, or his teachings, that sounds odd, but it is teaching. He's sharing what he knows. His articles, the way he presents his information is always in such a caring, thoughtful, loving way, as somebody who has had his own mental health struggles and struggles with family members. So I do feel like it's anything that I'm referring to him, I feel like he's a safe place. And I'm just here to kind of, hopefully encourage you to look into the theory and look into what he has to say. So on that note, again, I've got the book here. The book is linked at my website. It's Brain Energy by Dr. Christopher Palmer. And there's another doctor another psychiatrist who I really like, is Dr. Georgia Eads. And I can't think of the name of her book, but I believe I have it linked on my website. So I try to, whenever I'm sharing anything with you guys, I try and make sure I have it at bellybrain.com. Okay, so Brain Energy, the metabolic theory of mental illness. Well, before I get started on that, I want to share a little bit about how I learned about all this. My family had gone through a mental health crisis with somebody that we love dearly a few years ago. And so in that, it really made me a little bit more aware of mental health issues and not only what the people who are suffering from them are going through, but the people who love them, what they're suffering through. And I've learned in my conversations with people, who have family members or loved ones who are in crisis, that usually it's a lot worse than what you think and what people are willing to share. And I just think there's still so much stigma around um, mental health issues that people don't want to tell you the whole story. And that really breaks my heart. And that was something that, yeah, I uncovered over the past few years, which made me more passionate, or actually made me passionate about wanting to share this information, because any little bit of help that people can get. A lot of these families, there aren't a lot of resources for people who are struggling, and they become, a lot of these families are trying to figure it out themselves, and they're trying to figure out what can we do in our power to help our loved one. And I believe that nutrition can play a big role in that. That's not necessarily the cure all for everything, but it's something that we can do to help our loved ones and to help ourselves. And if you read Dr. Christopher Palmer's book, actually, he has cases where people have been pretty much, I don't know if cured the right word, but have conquered their mental health issue by basically what they're eating and been able to get off their medications. So again, heavy topic. I'm not advocating anybody stop any kind of medication. You're under a doctor's care, stay under a doctor's care. I'm just hoping you'll look at this maybe from another angle of something to support, something that you can do in conjunction with what your medical provider, what your doctor is recommending. So basically, I was diving into my own kind of health stuff and working towards my uh, functional nutrition certification. And I'd been listening to various podcasts, and this podcast popped up out of the blue, and it was Metabolic Mind. And I thought, well, what is metabolic mind? I've always been fascinated with all things metabolic because I've had my own health issues that I've struggled with, but I'd never made that connection. And so I tuned into the podcast, and I'm listening to the story of this very loving, sweet family who had a son. His name's Matt or Matthew, and he had struggled with mental health issues kind of his entire childhood, and they've gotten progressively worse as he got older. And this family they're pretty wealthy, I believe, and had access to all the best care, anything that you could need. And they still weren't able to really help him. And, from what he kind of gives his testimony in the interview, but he tells the story of after years and years of different medications and going on and off medications and going through psychosis, and he would disappear for days on end, and the family wouldn't know where he was. And he'd come back and he'd get on his medication and he'd be okay for a while, and then he'd get off of it. And it was just the story that we hear over and over and over again, and the story that I knew well. And I know a lot of other people can relate to. And he'd gotten to a place where he says he was okay, but not great. And long story short, he ends up doing the ketogenic diet and using that as therapy for his mental health issue. And he basically, with that therapy, was able to get off his medication and is doing great. And now he's got this testimony to share with people about how his diet changed his mental health condition. And I'm not advocating for any particular diet theory for anybody necessarily. So I don't subscribe to one diet theory here at Belly Brain. All of our bodies are different. We all have different we all metabolize our food differently. Some of us some of us are vegan, some of us are vegetarian. So we have deep beliefs that drive our what our diet looks like. So I'm not advocating for one diet theory here, but I do believe that certain diets can help certain people with certain conditions. And so when I started listening to this interview, I started diving more into the ketogenic therapy for mental health conditions. And interestingly enough, I had learned that the ketogenic diet was developed over 100 years ago as a anti-seizure diet. And I learned later that a lot of the medications that are prescribed for mental health issues are very similar and have the same chemicals in them as anti-seizure drugs. So isn't that interesting that a diet that works for seizures might also help with mental health issues. So Matthew's family, if I'm remembering the story correct, Matthew's family ends up forming, I think it's called the Bazooki Group. I hope I'm getting this right. And then they end up forming this nonprofit called Metabolic Mind. And that was how I came across this story. And so I immediately bought Dr. Christopher Palmer's book because he was kind of looped into this interview. And that's when I discovered all things brain energy. So if you have somebody in your life who is struggling with a mental health condition or mental health issue, I know we're trying to get away from saying mental health illness, although I know Dr. Christopher Palmer, he seems to believe it is an illness a lot of people are suffering from. I know that term, we're kind of phasing out of using that term, but if you have somebody that's struggling, I highly recommend you either send them this video just so they maybe can learn a little bit about it, or send them to my website, or send them to the book, Brain Energy. Okay, so I'm just going to read to you now from Dr. Palmer he's written he's got a lot of interviews and a lot of articles on Psychology Today. So I went to that website and I picked out a couple of the articles that I thought were the most interesting. And this is the Brain Energy, the Metabolic Theory of Mental Illness. And this is from Dr. Christopher Palmer. Mental disorders are a growing crisis and are the leading cause of disability on the planet. Although we have many treatments to offer, they fail to work for far too many people. Though we have dozens of antidepressants, different types of psychotherapy, electroconvulsive therapy, transcranial magnetic stimulation, ketamine, and other treatments available. Although the problems with access to mental health care might explain some of these increases, even when people get treatment, it often fails to put illnesses into full and lasting remission. Why can't we do better? In the end, it's because no one can answer a fairly simple question. What causes mental illness? Instead of a full and complete answer, we only know some of the factors involved, which include neurotransmitters, genetics, hormones, inflammation, substance use, trauma, adverse childhood experiences, and stress. How do all of these fit together? Again, no one knows. In the just released book, Brain Energy, I argue that mental disorders are metabolic disorders of the brain. This new theory integrates decades of clinical neuroscience, genetic, and metabolic research. It includes all of the biological, psychological, and social factors that we know play a role in mental illness and combines them into one unifying theory. This new understanding answers questions that have long plagued the mental health field, but also offers the new treatments, ones that come with the hope of long-term healing as opposed to just symptom reduction. What is metabolism? Although many people think metabolism is burning calories and related to weight, it's actually much more than that. Metabolism is a process that all living organisms use to convert food into energy or building blocks for proteins, membranes, and other cell parts. It is fundamental to the definition of life. When there are problems with metabolism, there will be problems in the way cells function. I argue that metabolic dysfunction in brain cells can explain all of the symptoms of mental illness. Although metabolism is extraordinarily complex and involves numerous chemical reactions and pathways, it turns out that there is an easier way to understand metabolism, and that is through tiny organelles in most of our cells called mitochondria. They are the primary regulators of metabolism. Doing a deep dive into the science of mitochondria helps us understand all of the factors related to mental illness. By better understanding the science of metabolism and mitochondria, we can finally connect the dots of mental illness. The much more exciting news about this theory, in my view, is that it opens the door to new treatments, interventions such as diet, exercise, stress reduction, sleep management, and reducing substance use can effectively treat mental disorders in many people. You might be thinking that this is nothing new. We already knew most of that. However, understanding the details of the science can lead to new and surprising treatments, such as dietary interventions to treat disorders like schizophrenia and alcoholism, which on the surface don't seem like they are related to diet. Some patients with schizophrenia have experienced full and lasting remission of symptoms off antipsychotic medications for years now. And then he's got a Psychology Today post that he links to. So I'm trying so hard to be concise and make sense, but that just gives you a little snippet of the brain energy, the metabolic theory the brain energy theory. And I really kind of feel like what I wanted to talk about today was, what does that look like in children? So that's a real soft spot for me when I see children and young adolescents who are really suffering and trying to navigate through mental health disorders or anxiety or depression. It really breaks my heart. And I think about what happens to these young people as they age and become adults. And I really feel strongly that we need to get them the help that they need early on. And if nutrition plays a role with that, then that is my goal, to get that information out there. So in Dr. Palmer's articles that he wrote in Psychology Today, he has one that is, it's changing a child's diet might help prevent mental illness. Okay, so I'm going to do more reading. I hope that's okay. But again, I don't want to mess this up, and I'm not a therapist. I'm not qualified to freestyle on this at all. I can talk about nutrition, but that's about it. So if you have a child, a grandchild, a child in your life that you're starting to see the signs. Maybe they've been diagnosed with ADHD. Maybe there's some depression settling in, anxiety, hyperactivity. Are you looking at the diet for that? Because I know that I think a lot of us have gotten more aware over the past couple of years about the problems with our ultra processed food and food dyes and the chemicals in our food. They're slowly poisoning us. I mean, there's no other way to say that. And, are you looking at your child's diet in conjunction with the therapies that you're using? Maybe there's something more that can be done. There was a documentary that I watched, and this is right after I had heard about the metabolic mind, and it's called The Magic Pill. And it's a great documentary. Again, it's linked at my website. I don't sell any of this stuff, you guys. I just have links there at bellybrain.com so you can easily find it. So if you look under the documentaries tab, you'll see The Magic Pill. And in that, there's several stories about people who've been able to conquer their illness, various illnesses, through changing their diets. And mostly it's a lot of these people were moving away from a ultra processed or highly processed food diet into a more whole foods diet. And the changes that are made are huge. And one of the stories that really stuck out to me is this family who has a daughter. She's got autism. And again, I don't want to say anything here to diminish any of the work that people are doing with people who have mental health issues, or who are struggling with ADHD, or who have children on the spectrum or autism. It's just another tool in the toolbox, right? Another thing to look at and think about when we're looking for help and answers for our children. But this little girl, her family ate a pretty typical American diet, not very healthy, lots of processed foods. They thought they were making some healthy choices, but basically everything that they were eating came from a bag or a box. And so they made a radical change in their diet and moved really into a lot of whole foods, almost kind of more like, I don't know if they went full blown keto, but definitely higher fat, lower carb type diet. And their daughter, who was pretty kind of nonverbal, if I remember correctly, really picky eater. Really, they were just really struggling with her and outbursts and just a lot of difficult, challenging situations they were put in, and we're trying to work through with her. And the change in the diet, I want to say within a month, taking out those ultra processed foods, she was like a different child. I mean, it didn't cure her autism, but a lot of the behavior was the behavior that really, really changed. And it just, when I saw that documentary, I just went, how are we not talking about this all the time? And so that was another thing that kind of got me going on this mission of mine. So, but yeah, The Magic Pill, really great documentary to watch if you want to learn more about this and you want to um, learn more about the story. And then I just came across, gosh, shoot, I had it in my brain and now I've forgotten. But I did post the interview on my Facebook page. So Belly Brain has a Facebook page, Instagram, as well as my YouTube channel and Spotify. But there's a mother and daughter duo, and they're just couldn't be cuter. And they've got an Instagram page. I think it's a better human. I think that's what it's called. And they did an interview. It's a Metabolic Mind interview, and the daughter had some definitely some kind of severe mental health issues she was struggling with at a young age, and they were having a hard time putting her in school, and it was pretty bad. And they went radical and switched to ketogenic diet. And this daughter is you would never know that she suffered through everything she suffered with. And it's really, it kind of brought me to tears. It really was like, wow, just this one change in this family completely changed everything for the good for them. And this little girl, now she's an advocate for the ketogenic diet for her therapy, which is pretty remarkable. And she knows that it's better to stay in ketosis for her than to get out of it. And she just feels much better. She knows what happens. And I think they maybe started this when she was 8 years old, and now she's 11. And she's like, I know if I go out of ketosis that all of those symptoms, all of those things start to come back, which I just find fascinating. So lots of stories out there. I wish it was, it feels like it's still a secret, right? It feels like it's a secret that we're talking about nutrition and how it affects our mental health, which to me, it's so obvious that plays a role, right? I mean, everything that we put in our bodies makes a difference. Like I said, not to say that it's going to cure everything, but it's a tool in the toolbox. So back to this article that Dr. Palmer wrote about children, and I'm going to read directly to you. We all know that diet plays an important role in health. It clearly plays a role in weight, diabetes, heart attacks, and strokes. Most people, however, aren't too worried about these things in children. These are usually diseases of older people, so most parents don't think about them when it comes to their children. Many parents don't worry too much about what their kids are eating. They're young, after all, so they can usually burn off any extra calories. Newly published research, however, raises concerns about this approach. Researchers are beginning to make the connection between insulin levels and children developing serious mental illness. The researchers followed almost 15,000 children from ages 1 to 24. They measured fasting insulin levels at 9, 15, 18, and 24 years of age, and body mass index repeatedly over the 24 years. Then they measured the children's risk for depression and psychosis at 24 years old. What they found was alarming. Children who had persistently high insulin levels, a sign of insulin resistance, beginning at age 9, were 5 times more likely to be at risk for psychosis and 3 times more likely to already be diagnosed with a psychotic disorder, usually bipolar disorder or schizophrenia. These are devastating disorders that can ruin lives. These children were also at somewhat higher risk of depression, but it wasn't a statistically significant difference. Children who had significant increase in body mass index around the time of puberty were 4 times more likely to develop depression by the time they turned 24. They were also more likely to develop a psychotic disorder, but this difference wasn't statistically significant. With depression now the leading cause of disability in the world, it's not a disorder to take lightly. Unfortunately, this research can't tell us for sure if changing diet in childhood or adolescence can make a difference, but there is reason to believe that it might help. It will certainly help to address obesity and the risk for diabetes, which are no small matters. Pay particular attention to significant increases in BMI around the time of puberty, according to this research. Ask your child's pediatrician if she will check a fasting insulin level for your child. This could be particularly important if you have a family history of serious mental illness. If either the BMI or the fasting insulin levels are abnormally high, you and your child can do something about this. Dietary interventions have been shown to help reduce weight and insulin levels. So, what do you do if you think that maybe your child is suffering or has some insulin resistance going on, and maybe that could be tied to some ADHD, anxiety, depression? What kind of diet is recommended? And Dr. Christopher Palmer writes, sadly, this is where there is tremendous controversy. The dietary guidelines for Americans have been around since 1980. Unfortunately, since that time, rates of obesity and insulin resistance have skyrocketed. The most recent version of the guidelines issued in 2020 didn't include any research related to weight loss or insulin resistance. So it's not clear if those guidelines will help people address these issues if needed. That's sad. I really feel like insulin resistance is a real issue in our society, and you would think that would be one of the main things they want to look into when they're coming up with the guidelines for our country. Some people are recommending the elimination or reduction of processed foods in favor of eating primarily whole foods such as meats, fish, poultry, vegetables, and fruits. The paleo and Whole30 diets are examples of such diets. For addressing insulin resistance, there is some evidence that the Mediterranean diet can help. Low carb diets can also help. In 2019, the American Diabetes Association introduced guidelines which include low carb and very low carb diets as one way to reduce blood glucose levels and improve insulin resistance. They reported that the low carbohydrate eating patterns are among the most studied eating patterns for those who have type 2 diabetes. So, and he says also with children, it will be important to develop a plan that he or she is willing to try. Ideally, the entire family should make a change as well. It'll increase the likelihood that your child can stick with the plan too. So that's what happened with the family that I was telling you about in that documentary, The Magic Pill. And it was interesting because not only did the daughter see tremendous benefit from changing their diet, but grandma had a lot of ailments that she was able to kind of tackle and heal with the change in the diet. And it was just really amazing to watch the transformation in this family. And, I there's so much that goes along with everything I'm bringing to you today. So I'm just trying to give you the highlights. So to kind of summarize the gist of this episode today was really making that connection between our metabolic health and our mental health. So not just what's going on with your gut health, but your overall mitochondrial health, and which of course we are what we eat, and we are what our body does with the food that we eat. And we're building our mitochondria every day with the way that we live, the way that we eat. And so, I really feel like it's a breakdown in our metabolic and mitochondrial health is one of the key reasons that we're seeing so many mental health issues coming up in our children. And that's just my belief. I know other people may beg to differ, but that's what I believe. That's what Belly Brain's about, is getting that information, helping people to feel empowered, making smart choices, and knowing that you do have a role in your health. And yeah, so I'm hoping that this little bit kind of gets you inspired to look into Dr. Palmer and his research and maybe read his book Brain Energy, um, and really understanding that connection between insulin resistance, metabolic health, and mental health. And our next episode that we're going to do, he did a really interesting article about diabetes and depression. And it's called Diabetes and Depression, Which Comes First? So again, we're tying that back into metabolic health, mental health, that connection. So thanks for tuning in. I hope maybe you pulled something from it, and that's helpful and inspires you to do your own research. And so I'll see you next week. Thanks for tuning back in. Bye.